Hi everyone, my name is Nasir and I'm a GP in Liverpool. Today we've got Jassim Navas with us, who's a sports and exercise medicine trainee and a GP. We'll talk to Jassim about what exactly is sports medicine training, how to get into it, what's training like, how's life after training, and if I become a consultant in this specialty, can I become the doctor of my favorite sports team? And how will the changes to the medical training prioritization bill affect my chances of getting into training? Now, without any further wait, let's welcome Jasim. Thank you for joining us, Jasim, and congratulations for making it a training. Well done.
Thank you, Nasir. Thank you for giving this opportunity, and to share my journey with others. Thank you.
But thank you. So, do you want to tell us why we're doing this video?
Yeah, there are a few reasons why we thought of doing this video. So one of the main thing is to create awareness among doctors what sports and exercise medicine um, as a specialty involves, what you can do to get into sports and exercise medicine specialty, and how what's the specialty training is. And I posted about my journey in one of the social media group, and I received tons of messages, um, uh, like from a lot of doctors, IMGs, doctors who were trained here before. So regarding how they can get into training, guidance that I can give to them, and what the training involves, and what the specialty itself involves in UK. So these are the few reasons so why we are doing this video. And all these things that I'm explaining, telling is my story and my journey and my experience, how I reached here.
So, thank you for sharing your experience. Do you want to tell us a bit about yourself?
I'm Jasim. I am one of the sports and exercise medicine trainee based in East Midlands. I'm one of the two trainees. There are two trainees in East Midlands, and I am an IMG from India. And after coming to UK, I did my GP training. I CCT'd in GP training, GP, and then I worked as a GP for nearly 1 year, and then applied for the sports medicine training, and fortunately got into sports and exercise medicine training.
So, when did you decide that you wanted to go into sports medicine?
The decision regarding whether what I need to do, and my interest in sports and exercise medicine specialty started quite early itself. Maybe I would say during my medical school time itself, because I was quite into lots of sports and also like physical activity, and I was quite active in different multi sports, and I was quite a advocate of how physical activity can promote healthy living. So this is one of the major reason why I got into sports and exercise medicine training, and that's the sole reason why even I came into UK also, to train in UK in sports and exercise medicine.
So, you mentioned you're into sports. So, what sports are you into?
So I do multi sports, and especially like I played badminton for the university during my medical school, and I still continue to play cricket for the local county, and still involved in other sporting activities also here.
Nice, well done. So, can you walk us through your journey of what you've done so far after med school and getting into UK?
So after my med school, I worked in India for nearly 2 years, more in acute medicine specialties and emergency medicine. And during that time, I prepared for the PLAB exams and came to UK, and worked as an SHO, as how most of the IMGs do. And I think I worked for nearly 8 months, and then got into GP training as early as possible. And then once I completed my GP training, which I completed like in more than just 3 years, and then I worked in the same practice where I trained for nearly like 1 year time. And then during that time, I prepared for the interviews, and also prepare for getting into training. And then I got into training, and it's 6 months now since I started my training. Yeah.
So, after you GP training, did you ever think about staying and working as a GP only?
Uh, uh, to be honest, like sports medicine was always in my mind. Yeah, so working long term as a GP itself was not always my plan. Even if
Mhm.
I was not like successful in getting into training, sports medicine training, I would have worked as a sports medicine, GP with special interest in MSK or sports medicine. So this was my plan, and basically I thought of about like doing GP training because I thought that that's one of the better specialty to get into sports medicine.
That makes sense. And it sounds like there's a lot of homework that you've done for this, and we'll get into that. But let's start from the basics first. So, what exactly is sports and exercise medicine training?
Sports and exercise medicine, as the name suggests, like it have three streams. Sports, which involves mainly one is the MSK, musculoskeletal issues, where we are dealing with complex musculoskeletal issues and treat different MSK conditions, provide appropriate investigations, do ultrasound imaging, and then do injections. These kind of things are what's happening in MSK world, and the sports medicine trained sports medicine doctors are quite competent in dealing with these MSK issues. And the next thing is the physical activity stream, where as doctors we are promoting physical activity, healthy living, and improving the decreasing the inactivity levels in the community, and where we are closely involved with the government and the health department to develop strategies and initiatives to improve the physical activity and well-being of the community. This is the second stream, and the third
Mhm.
one is the sports, light sports, where we support athletes, teams, and organizations to improve the health of the athletes, prevent injuries, treat acute problems of them, and promoting their rehab and recovery and getting back to sporting activity. So these are the three things that we tend to do in a nutshell.
So, I'd say it's MSK, well-being, and sports. So
Yeah,
it's not just
physical
sport.
activity and yeah, physical activity promotion and then sports.
So you said that you felt general practice was a good way of entering training in sports medicine. So what exactly is the eligibility criteria for getting into sports medicine?
So the eligibility criteria to get into sports medicine is, first, definitely we need to have GMC registration, and then we have to do at least three training pathways. Either of these three. One, we can do GP training and get CCT in GP, and then get into training. Then next one is the IMT pathway, where we can complete the MRCP exams and IMT, and then get into that. And next one is the ACCS pathway, where it's acute care common STEM. I think, yeah, I think so.
Hmm. Yeah.
And so once we complete those training and do the competitive exams, then we can get into sports medicine training. So these are the three ways which where we can get into sports medicine training. So we have to complete all the membership exams of the respective specialties to get into sports medicine and do a proper training.
Thank you. So how does entry pathway work? What's the entry like?
Entry, like, means, is it regarding the process that you're looking for, or
Yeah, so like how many times does the training open? How many seats are there? Is it
oh,
score-based interview as well?
mm, okay. So the training opens once in a year, and
Okay,
there is no second round, just one round of training. So one round of application and a selection. So,
sure.
and roughly there would be 8 to 9 seats in an average. That's all over the UK, and it's spread
Okay.
all over the UK in different places. And as I've
Mm,
told you, in East Midlands, when I applied, there were two training numbers, and
mm,
London, Oxford, East Midlands, West Midlands, then Northwest. Those, and now there are training seats in Scotland also. So average, there are
mhm.
only 9 training numbers, 8 to 9 training numbers. It can come down or maybe slightly go up, and it's quite competitive. It's very competitive, and from
Okay.
my research, I think there were like 110 applicants for this when I applied for it, and the
Hmm.
competition ratio was more than 10. So that's how competitive it is to get into it. And so the training so the no sorry not the training, the selection process involves, first thing is self-assessment, where these all things are done through the Oriel website. So first one is a
Okay.
self-assessment, so where we have to have certain marks in certain domains, and where we have to score quite a high marks in each domain, and then get a maximum score, and then we are selected for the interview after that. So the scoring for the eligibility, scoring for the self assessment determines our eligibility to get into interview process. So of these applicants, around 20, maybe 20, 25, or something like that, people are elected for the interview. And then
Hmm.
next is the interview process, where we have to score very high in the interview, and then we are selected for training based on the interview and also the eligibility scoring marks. So if you want, I can share those
Sure.
things with everyone, so that could be quite helpful.
Sure. Yeah, if you want to share your screen.
Yeah, sure. Okay, great. Can you see the screen, because I'm not able to see
Y-
myself?
yeah, yeah, we can see.
Okay, so this is the gold standard page where all the details are there. So you have to go into physician higher specialty training recruitment website, and then select among the specialties. You need to select the sports medicine, and then so these are the different things. You can see this is the gold standard website. You can see the interview scoring, and the stations there, then the interview dates and the total number of posts. And also you can see also the data, how competitive it is, and competition ratio, the filling ratio, and the scores, and those kind of things there. Yeah. And the next thing is the, as I mentioned, so um, you can see yeah, you can see that there are a lot of domains here. This is the application scoring, self-assessment scoring,
Mm.
where you need to have good scores. You can see here postgraduate degree. So if you do a PhD or MD, you will get 4 marks. Masters, which I have done a masters in sports medicine, I got 3 marks for that. So, and then you can do the MRCP or MRCGP exams, which also scores, which have some scores. And you can do the poster presentation, so which I have done poster presentation in one of the international conference. Then publications, I had done around 2 publications, of which one I was the first author, so I got the maximum marks for that. Then teaching experience, I was constantly involved in teaching F2s and medical students, where I do training. So we have to provide all these details, also all this appropriate documentation also regarding what we have done and all. And then we can get more scores for a PG certificate in teaching and quality improvement project, which is also very important. I think I have done like 7 or 8 quality improvement projects during my 3 4 years time. And so yeah, so this is the basic things to get a good mark in the scoring. Yeah.
Thank
Let,
you. So you said lots of domains, lots of things.
yeah.
And I suppose after this, next step was the interview. So how did you go about your interview?
So interview, like as I have mentioned, it's very competitive. So we have to prepare quite well for the interview, and so we have to. One of the most important thing is we have to have a good in-depth knowledge and an idea of about the specialty itself. And so that's one of the thing, one of the station where we have to prove our commitment to specialty. And the next one is clinical case. We will be having clinical cases. Then the next one is the ethical case. we have to prepare quite well for the interview as any other interviews, and I prepared very well for the interview, and especially to structure our answers. That's one of the most important thing. And especially as IMG, we might not be that used to interviews, and especially higher specialty training. The interviews are also quite marked very strictly, and so this is how I prepared and for the interview. And regarding the interview itself, I think I attended one of these course or Oxford interview course, which was 1 day course, which I attended, which was quite helpful just to more to structure my answers, and to get to have an idea about interview and all.
Thank you. So it sounds like it was a lot of work, which is why you started your prep early. So that makes sense.
Yeah.
Now, can I ask what's life like once you get into training? How long is the training? What's your rota like? How does it work?
The training is 4 years, same like any other higher specialty training like gastro, cardio, nephro, like 4 years training, where we will be rotating 6 months in different places. Since I'm in East Midlands trainee, I would be rotating more in Leicester and Nottingham. So
Mhm,
I will be having rotations in sports medicine clinic, public health,
mhm,
GP, A&E, medicine, rehab, team care, like with any sporting teams.
mhm,
Then yeah, these are my rotations, and the work itself, most of the deaneries, including our deanery, we are all more kind of supernumerary role, and it's more kind of a 9 to 5 job most of the places. We don't have any weekend on calls or anything like that. It varies in different deaneries, but most of the
mhm.
deaneries is same. So it's very well supported training, especially they focus more on our learning and our career progression, and how we fulfill the curriculum and things like that. So this is overall the training in a nutshell. Anything else that particular that you want to know?
In training, do you have any exams you need to pass?
Yeah. So we have two exams. So one is MFSCM Part One and MFSCM Part Two. So member faculty sports and exercise medicine exams Part One and Two. First one is the MCQ, and the next one is the OSCE exams. So we have to clear these two exams during this 4 years time to have a CCT in sports medicine. So yeah.
I see. So, I suppose the way it works is, if I understand correctly, the timeline would work something like this. You get into IMT or ACCS or GP training. You complete that, then you get into sports and exercise medicine training. You complete that, and then you get, like you said, CCT. CCT stands for Certificate of Completion of Training, meaning that you become a consultant. So after that, once you become a consultant, how does it work? What do you do? The question people ask is, can I become the doctor for my favorite sports team? How would you go about life after CCT?
Yeah, so interestingly, the last thing that you have mentioned is one of the most common thing that I hear here from doctors who are interested in this specialty, whether they can be a team doctor or things like that. So yeah, that's definitely possible. So, but what I would always say is that that's one of the very small element of sports exercise medicine specialty in UK. So once we become consultants, so we work in different areas, so we have a more kind of a portfolio career. Most of the doctors work in the NHS, where we work in the MSK clinics supporting the complex MSK patients, complex MSK issues, and then we work within a multidisciplinary team where we work with the physios, podiatrists, then uh, then nurses, nurse practitioners, advanced nurse practitioners, different people there, and we come up with a plan how we can manage the patient holistically and improve the care of the patient in that particular session. So this is one of the NHS roles. And next thing is we can work closely with the public health, where, as I mentioned, we can promote the physical activity. bring new initiatives, new strategies to improve the physical activity in the community. For example, this moving medicine, which is a this moving medicine, which is a great initiative, which they train doctors or other health professionals to have a good awareness about the physical activity promotion among other clinicians and in the community. They train doctors and other clinicians for that. So similarly, we have a lot of projects we can involve in. The next thing is we can work in private, so we can work within private medical organizations to do the same, the MSK things, MSK bit. And the last one is team care, where we can work with a team or an athlete or other sporting organizations like FA, FIFA, or ECB. So these kind of areas where we can help athletes and promote the well-being of the athletes. So this is how, as a sports medicine consultant, we work. I think it's more kind of a portfolio career, rather than doing just rather than just doing a single thing. So yeah. And most of the time, so none of the clubs or the teams might not hire a doctor who need to work like 7 days in a week for them. So there might be exceptions. Yeah.
What's a portfolio career? What does that mean?
Portfolio career means where we are doing different things rather than just doing one kind of particular job. For example, if as a acute medicine doctor, if we are working in acute medicine wards for 5 7 days in a week, it's not a portfolio career. Whereas in a portfolio GP, as a GP also, we can do a portfolio career where we can do the NHS job, we can do teachings, we can do research, we can do research, then we can maybe we can work in out of hours. So we are doing different kind of things rather than just one single thing. So that's what is called a portfolio career. We are doing multiple things rather than just doing one single thing.
I see. Thank you. So, yeah, like you said, it sounds like there are multiple options after
Yeah.
you become a
Yeah.
consultant. Considering the saturation in the current job market that we hear about, how do you see the future of sports and exercise medicine jobs? Do you think there are enough opportunities out there?
Yeah, so this is one of the common thing we ask our seniors and the consultants and the organization that we involve in. So currently there's job saturation everywhere. Every specialties have the issues
Mhm,
there. So I think things would change. And as I have mentioned, so as sports medicine doctors, we can do a lot of things,
mhm,
portfolio career, which I mean. So we can work in different areas. We can also start our own service where we can link with a group of GP practices, ICB or PCN, and then we can start the MSK service there. How much burden is there in our community, especially especially a lot of MSK cases that we are seeing now, and the burden, not only like physically but also financially, to the UK. So there are a lot of options we can involve. So I don't think there would be a issue, but still the NHS consultant jobs are quite scarce, to be
mhm,
honest. But we need to explore things, and things can
mhm.
change at any time.
That makes sense. Another question people ask is, how will the changes to the medical training prioritization bill affect entry into training for sports medicine?
So my knowledge regarding it is quite limited, but if there is prioritization, it can affect specialties definitely. um, Especially as an IMG, I know the difficulties coming to UK. So where we have to deal with family issues in one side, like coming from another country to come here, settle here, work within this healthcare system, and on one side, and our career on the other side, it would be quite difficult. But prioritization could affect, but things can change at any time. And there are a lot of news going on in the media and also in different websites. So to with regards to sports medicine, I don't know how much it will affect, but in order to get into sports medicine, you have to work nearly like at least 4 to 5 years here and have a degree like GP degree or some CCT. So I don't think it will affect to get into sports medicine, but because you would be already having a CCT and having good NHS experience before going into sports medicine specialty. Hope that answers. And things can change, and you know how things have changed from maybe like in the last 6 7 years time. So yeah.
Yeah, I think that's
what
reasonable.
what are, what are your yeah, yeah. Yeah.
I think it's difficult to predict the future, but I think it's
Mhm.
important to rely on official websites, stay updated,
Mhm.
uh,
Yeah.
follow news only from official sources.
Mhm.
Uh, you talked about uh, um, getting into training and life after training and getting jobs and staying connected with people. So I think you're talking about networking. Any other tips or advice you would like to give for people in the end who want to specialize in sports and exercise medicine training?
So what you have mentioned is one of the most important thing, networking, and speaking with people who have been in this specialty, who have worked in this specialty for a long time. That's what I also did, because during the time when I came here, there wasn't much information about the specialty even, and there were not much people whom I were not able to uh, assess before coming here. What I did is that I did a good networking. I attended multiple conferences, or the BASM conference. BASM is British Association of Sports and Exercise Medicine, which support doctors, um, provide courses, provide train doctors to help to improve their sports and exercise medicine awareness and knowledge. So Basson supported quite well, and especially when I went for the conference, I meet new people who has been in the specialty for long years, and I seek all the opportunities they give to me and ask their guidance, ask their help. So this is one of the most important thing that we need to do if we are if you want to get into sports medicine training. So that's one of my suggestion. Then then the next thing is that like um it would be also quite helpful um to stay focused. Yeah, that's the most important thing, because we have to have an aim and a focus rather than deviating from one thing to another. If we have a good focus, then we can get into where we want to be. So that's another advice that I can give other doctors, especially the IMGs. And yeah.
Thank you. So, sounds like it's important to stay focused, start early, like you
Mhm.
get into a program, which is IMT, ACCS, or GP.
Mhm.
Um, you showed us the screen for building portfolio and the things that they
Yeah,
need,
yeah, yeah.
and like you said, in the end, networking. Um, any final advice or any tips on how to be in touch? What's the best way of asking you questions? I know we'll post this video on YouTube. Is it easier to comment under the video?
Yeah, 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 absolutely. You can comment on under the video, and the other thing that we can do is that if there are more people who want to know more about this specialty and training pathways, training, then maybe we can do another video where I can share more information. We wanted to keep this video as concise as possible to for people to have a good comprehensive overview of this thing of sports medicine. So that's one of the things. So we can do another video and we can do a Q&A session there, where people have a lot of things in their mind, they can ask questions there. That's one of the thing. Or they can message or just write their doubts in the video, and then we can try to answer.
Perfect. Thank you so much. So we'll
Or you
keep
can follow me in LinkedIn, then I might be there, so you can message me there also.
perfect. Thank you. Thank you for being approachable and thank you for doing this video. And congratulations again for making it your
Yeah.
training. Well done. Thank you.
Thank you very much, Nasir. Thank you. Best
Thank you.
wishes.
Take care. Thank
Bye.
you. Bye bye.